Now if I can find my way back to my Zoom screen. Well, welcome everybody. Apparently earlier, Haley and I thought we were live and we were not. And we had a lovely intro and beginning of this conversation without you, but it'll be even better this time because now we've practiced. So welcome everybody. I am Celeste Williams, family nurse practitioner and former Democratic candidate for U.S. Congress. And I am here with Haley to have a conversation about long-term care and COVID-19. There is a lot of feedback and I can hear my voice in my head. Can you hear it?
No, I can't hear anything.
I bet it's, let me see, it's me. Well, I will see if I can ignore that. We'll try. So anyway, I think it is important to, even though I'm not running for office, keep having conversations about important things that are going on in our community and that affect our state. And certainly living through a global pandemic is one of those things. And so, you know, our older friends and neighbors and citizens are at far more risk to death and really severe COVID-19 illness. And so, you know, Haley is a former family nurse practitioner, a nurse, former CCU nurse. She and I actually met when we worked together in Fayetteville, Arkansas. And we went to graduate school around the same time and in the same program. And so I thought she would be a wonderful person to join us here because she is also now with her husband an owner and operator of a nursing home, long-term care facility, and in Charleston, Arkansas. And so thank you so much, Haley, for joining me.
Thank you for having me.
So just sort of on background, I think it's important to think about, you know, why is this so important? And, you know, here in the United States, about 52% of Americans who are 65 and older will at some point in time in their life need long-term care. And even though only about 1% of our citizens live in a long-term care facility, they account for 39% of US COVID-19 deaths as of December 10th of this year. And then just thinking about long-term care spending, most of that money comes from state and federal government. And long-term care, it comprises both health and social services for long-term care dependent people who need care on an ongoing basis. And the U.S. spends 0.5% of its gross domestic product on long-term care. And then, you know, you think about like compared to what? Well, in the Netherlands, they're the top end and they spend 3.7% of their GDP. And we're really sort of on the lower end, but that doesn't count private pay or care that people provide to their family members at home. We don't really track that spending here. And so, you know, a lot, looking at the data on COVID-19 from CMS, Arkansas is really sort of in the middle as far as how we're doing with deaths and number of infections per capita. So compared to other states, we're really pretty much in the middle. But here in Arkansas, which was, this data was updated on Friday, December the 14th, we've had 12,023 total residents who have died, and that's in people in long-term care facilities. Wait a minute, that's how many positive. And we've had 1,285 who have died, and staff, 1,574 have been infected, and 6 of those staff members have died. So that was a lot of background information. But I want to ask Halie, so who are the people that come to live in a nursing home or a long-term care facility?
That can be a various different type of people. We have, of course, elders. We might have somebody that may come in when they're younger. We're having people have strokes when they're 50 years old and they cannot live by themselves anymore, and they're having to come to nursing homes. People that at a younger age sometimes even need total care, and they will come to a nursing home. We also have rehabs skilled in nursing homes, and these are people that are there for temporary rehab, physical therapy, occupational therapy, speech therapy, and they may stay, a month, they may stay 6 weeks, getting better, getting stronger, and then they discharge back home to the community. So I think people still don't realize that nursing homes have this service available also.
So, what does it cost to live there?
It costs a lot. It costs thousands of dollars. That's different at anywhere you go or you call. Sometimes people don't realize, though, when you're paying for a nursing facility, you're not paying for a side of a room, or you're not paying for a bed. Mm-hmm. You're paying for the care, for the total package. You're getting medical directors. You're getting RNs 24 hours a day. You're getting LPNs 24 hours a day. You're getting CNAs that know you, love you, want to take care of you there all the time. You have dietitians that come in and make sure your weight is stable. What can we do to increase that? You have all your meals, all your snacks. We have a pharmacist that comes in, looks over medicines, makes sure that nothing's going to interact. We have a complete team that's what you're paying for, to take care of you, to make sure that you have the best possible care available.
Yeah, it's a lot more than just a room and, a bed. It's these are people who need help with, their daily living activities. So I think about like a traditional business. I go to a store and I pay a set amount, and then I leave with some product. And that's obviously not how the business of running a nursing home is. So, how, I guess my question is sort of, who is paying for that?
Well, it can be paid in, there's different ways. Let me touch on the first part that we talked about, the rehab. You're at home, you fall, you break a hip, you go to the hospital, you have to have surgery, you stay in the hospital, 4 or 5 days. You cannot go back home because you need someone to help you get up. You need someone to help you take a shower. You need someone to get you back on your feet so you can get back to driving, get back to the community, do these things. That's paid for normally by your Medicare and a supplement, or if you don't have Medicare and you have something that you've replaced it with, we call them Medicare replacement plans, then they would help pay for those stays. Then there's the other side of the nursing facility, and that's more of the long-term care facility. That is paid normally 3 different ways. Private pay, you have money, you pay for it. You bought a long-term care insurance policy many years ago, and you use your long-term insurance care policy to help pay for that. Or you apply for long-term care Medicaid through the state, and that helps pay your stay there also.
So that would be our tax dollars being put to use to care for people and give them dignity and respect when they are not safe to stay at home anymore. And aside from that, I assume that if I were just super wealthy and didn't need that means of pay, then I could be a private pay as well.
Yes.
and pay
Yes.
my own way.
Yes. I like to kind of, explain to people that, nobody wakes up and decides to have a stroke or anything like that. It's something that happens. And, a lot of older Americans are living off of their, Social Security check, and that's it. So the state comes in and helps you make sure that you're being taken care of, because it is, like I said, the team that's taking care of you.
So how has COVID affected the residents of the long-term care facility where you live?
Well, it is, it's been a challenge, just like it's been a challenge, in all of healthcare right now. It's definitely been a challenge. The residents we have some of the best residents. They're just absolutely wonderful. And they've been so nice about it and so good about it. And they watch the news just like everybody else. And they see all these numbers, and they see that what's happening all over the world. And, they want to be safe. A lot of them want to be safe. But we immediately, back in March, were told, start a screening process. We immediately started that. It wasn't long after we started our screening process that we were told to lock down, and we could not allow family members to come in. And it was hard for a little bit, but we have found so many ways to stay connected. We do phone calls, of course, Facebook portals, FaceTime. We built a visitation booth back in the summer, and we've used that all the time as a way of communicating. We recently built what we call our Happy Home, and it is a visitation house that has walls with a wall down the middle, and it's decorated and warm, and it's going to be great for the cold weather. Also, I don't think that people realize that our residents are being tested frequently, because if you have a outbreak, as they call it, and one employee is an outbreak, then your residents have to be tested, and that can be every week. Sometimes if we don't have an outbreak for a couple of weeks, we might drop off 1 week, but it's been pretty regularly once a week, for sure. We also, our new residents that come in, we ask for a COVID test before they leave the hospital. We get a negative. We bring them into the nursing facility, and they are placed on quarantine, and they have to be in quarantine for 14 days. And that's hard because they're new to a facility. They're new to us. They're learning all of our, wonderful staff. They're learning our nurses, and they have to be in that room. But that is, just to protect the other residents, and making sure that because they've been at a hospital, they've been exposed to COVID in the hospitals or wherever they were, then we have to make sure for 14 days that they do not develop any signs or symptoms or anything that would be considered COVID. So that's also been a challenge, because they're in a room privately. And so we have to make sure for 14 days we have that room ready and available and ready to go at any time. And that's been hard too, with new admissions, because like I said, new admissions they're not familiar with us, and then they're put in quarantine. But we've really tried to go above and beyond and make sure that we're dressing out in our PPE, going in there, sitting with them, visiting with them, and making sure that they don't miss out on anything while they're in quarantine.
Which kind of brings me to how has this affected your staff?
Oh man, I just can't say enough wonderful things about my staff. They're amazing. All of them. They're getting screened, of course. This has been going on since about, I believe it was around August, and we go by a positivity rate in your county. So when your county gets above 10%, you go to twice a week testing, and it's not antigen testing, it's PCR testing. And so they get a PCR test if we're above 10% twice a week. If we stay below that, we can do once a week, but and handle it like champs.
So is
They
that
come,
staff and residents are getting the twice a week testing
no,
if you're
just,
above 10%?
no, just staff. And then if any of the staff are positive on those testing, we go into outbreak testing, and then all residents get tested.
Okay.
Because then there is a chance, if there was one positive, that we could possibly have had it brought in. So that's when residents have to start getting tested. Also, you know, my employees have sacrificed in personal ways. They're doing, you know, at Thanksgiving, we told all of our employees, you know, please try to social distance. Don't go to large indoor gatherings. Don't eat inside at a large table. And they did it. I mean, we just couldn't believe it. Our tests for the first 2 weeks after Thanksgiving were negative. We sent home with all of our employees. We've been wearing N95s for a while just for extra protection, but we sent home with all of our employees a huge packet of surgical masks. And we asked them, we said, listen, if you're going to be outside and you're going to have a small gathering of 5 or 6 people, ask everybody to wear these surgical masks. We're giving them to you. Ask them to wear them, put them on. And you wouldn't believe everybody that came and said, thank you so much for those surgical masks. You know, Uncle Bob showed up and didn't have a mask. I asked him to put it on and he wore it. So I really do believe that preaching the mask and helping them make sure that they can do this has really, really helped.
I think this is such an example of like doing things right. And I think a lot of times negative things get in the news, but I am really proud of the work that you guys are doing, and it's heartwarming. And I am sure that, you know, all of that expense for testing and PPE, you know, that affects the bottom line of your business. So has that, I assume that there's not a PPE fairy and a COVID testing fairy that just comes by and out of the goodness of their heart gives you all these things free.
No. PPE, as everyone knows, at the beginning of all this, March, April, it was scary. There weren't any N95 masks available. We were reaching out to family to see if they had any, and I would tell you all the response. We had people bringing N95 masks in, helping us out. The community was absolutely wonderful. Also, something that, you know, you talked about the PPE and the cost of PPE. Yeah, it's expensive, but also we have to have a COVID unit ready to go in case we have a positive or anybody that we think is positive. We have a COVID unit, and it has 10 of our beds shut down, and it is behind what I call like a plastic door that you can get through easily down one of our halls. And so if anybody were to be positive for COVID, showing any symptoms of COVID, they immediately get moved to this isolation area. So those rooms have also had to be shut down, which is it's sometimes hard because when you live in a small community and you know everyone and you get the support from everyone. We had the 3rd highest occupancy rate in Arkansas. So when we shut down 10 beds, and I'm getting calls from a 1st grade teacher that I've known for 50 years, and I don't have anywhere to go because I have rooms shut down, that's really hard. And we do everything we can to make sure that we try to move people around. You know, we're calling family members, asking if this is okay, and asking the residents, is this okay if we do this, if we can, you know, move this around and do all this. And it's just the support from the residents and families is like, you know, yes, we trust you guys. We know you're trying to do the right thing. You know, you have our blessing.
Mm-hmm. So did you receive CARES Act money?
Yes, we did. We did receive some of that. The governor of the state of Arkansas allocated some CARES Act money to the homes, you know, that really, some of the homes that really needed it, you know, less to other homes. But we used that money to pay our employees. A lot of that money went to employees as kind of like a bonus payment through all this at the beginning, not their, just their regular salaries, but it was more of like a bonus thing. And then it also helped pay for PPE. As you know, N95 masks at the beginning and still are extremely expensive. Gowns were hard to find. Everything like that was really hard to find. We've also bought, and I think we're one of the few nursing homes, we've also bought a UVC light. It's a large UVC light that we take from room to room, and we zap the rooms. You have to take the residents out, of course, and they wear masks and sit outside, and we zap the rooms. And we've also have iWave ion generators that we've put into all of our air conditioning units, all of our heating and air units that's supposed to kill the virus. We have what we call our COVID busters. That's our environmental team who has these sprayers that go on their backs, and they literally spray disinfectant, because we're having to clean constantly. Not that we didn't already, but you have to think about all
above and beyond.
Yes, you have to think of the high traffic areas. We have handrails, so you have to think about those being touched. Those are sprayed down constantly. You have to think about all the alcohol gel we've gone through. We were giving that out. They had, residents or employees had that in their pockets. We have one of those in every single room. We have one outside our med rooms, outside of our treatment rooms. And at first, there was a period of time that was kind of hard to get, but we had it. We've never not had it. So that's been a huge blessing.
Well, if you could ask anything of the people in Arkansas right now, what would you ask of them to help us address the COVID pandemic and keep your residents safe?
I would, first of all, the most important thing, wear a mask. Wear your mask. I don't understand why people can't wear their mask. It is proven to be effective. It is not hard. It is not hard to wear a mask. It is an easy sacrifice. I promise you, if you wear a mask, you're going to save lives. I know it. I've seen it. You're going to save lives if you wear a mask. I'd also ask.
You wear it under your chin.
No.
Should wear a mask properly.
Wear it
covering your nose and your mouth.
Your mouth.
Yes.
Make sure it's over both. If it's hanging down here, it's not working. If it stops right here, it's not working. It's got to be over both. Yes, 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 yes. I'd also ask that if you know a healthcare worker, if you know somebody in the long-term care industry, tell them that you're proud to know them. Thanks for all you're doing. They're working hard all over the state, in hospitals, nursing homes, everywhere. Everybody's working really, really hard. And so, be kind to these healthcare workers, and yes, wear a mask. I can't say it enough.
Yeah.
Wear a mask. Also,
wear a mask.
With
wash your hands.
Coming up, my husband and I didn't do anything for Thanksgiving. We did a Zoom call, and we have 4 kids, so we had lunch over here. We didn't go anywhere. We didn't do anything. I understand that it's hard, but I feel like hopefully by this time next year we can make up for all of this. Christmas time, if it's cold and you can't be outside with a small group, distanced out, wearing your mask, then you can't do anything. You can't bring it inside and not wear your mask. It's not safe. It's not safe at all. So, I'm hoping for nice weather for Christmas so that people will stay outside and distance and not come inside and get each other sick.
Should we encourage social groups in communities to get in large groups and have their Christmas parties?
No, what I've been
I will
telling
say, yeah, my clinic, we are not doing a Christmas party this year. I mean, it's just not I feel like letting these things go right now and doing things different is ensuring that you can invest in the future of having a Christmas party, because if we don't, before everyone has gotten an opportunity to get immunized, then we're just going to make this so much worse, and so many more people are going to be hurt by that. So
I totally agree. I mean, it's you ask yourself, is that Christmas luncheon inside with no mask, is it that important right now? Is that the most important thing? You know, I've got my staff who have been just going above and beyond. I have my residents who want to see their families. I have my family members that have just been so understanding and wonderful through this. Come down here and tell me in the face that your 20 person Christmas luncheon was worth it. I don't see it. Mm-hmm. You know, just not right now. Just wait on all of that.
So if you, would you have anything that you would want to ask of your state and federal representatives right now? Or, because I think sometimes we forget, we're not just powerless. We live, fortunately, in a free country where we have a democracy, and we are each empowered to be able to call our representatives at both the state and federal level and advocate for things that we need. And so if you were queen for a day, what would you ask? what would you demand for your residents?
Well, mine's simple. I really do think the state has been very supportive of us. I think the Arkansas Healthcare Association and Rachel Bunch at the Arkansas Healthcare Association, they've been amazing. The Arkansas Department of Health, I mean, we're having webinars, we're having Zoom calls. They're bringing so much information to us. They're answering our questions. They're there for us. But I think what I would ask is, please don't forget about us. Keep supporting us. Keep on. Keep making sure that everybody is okay. The next thing I would also make sure is this seems like a simple thing, but get some positive stories out there about long-term care, which they are doing. But there's some amazing things that go on in long-term care, and some communities who love their long-term care facilities. And let's get these stories out there, and make sure that these are being shared, not just the negative stories. Make sure that these are getting shared. And then I would push for all Arkansans, all Americans, everybody to get the vaccine. It's so important. We are waiting on the Moderna vaccine. We're hoping that it gets approved today, tomorrow, and then we will be getting our date set for when we can get our vaccine started. And I really would ask everyone, get a vaccine, put positive stories out there about the vaccine, make sure that people feel comfortable, that they know that there's positive results with the vaccine. Make sure that if there's questions, that we're getting them answered. I think it's important that people feel comfortable to get this vaccine, because we all need to get it.
Yes, I am getting the vaccine because I want to hug my parents. I want my kids to have normal school days, and I don't want to continue worrying all the time about whether or not I will accidentally get one of my coworkers or my patients sick. And looking at the data that is available, I feel very comfortable that it is safe and effective. And I think that with this vaccine, there's even more ongoing safety monitoring. And so, healthcare providers and frontline workers are getting the vaccine now, even here in Arkansas, which is so exciting. And, they can sign up with the CDC to continue giving updates on how they are feeling, and make sure that they're not having any undesirable side effects. And I think that can give us all more confidence that if there's a problem, that we're going to know, and that will be addressed. But there's been over 30,000 people in the trials, and I am comfortable that it's vaccines save lives. And actually, I say that vaccines don't save lives unless they are put in someone's body. And so you have to go and actually get the vaccine. And it's a series of 2. And so far, Pfizer is available. And as Halie said, the Moderna vaccine will be approved for emergency authorization use shortly. And we are so looking forward to using this as a tool to get back to a better way of living, because this has not been fun.
No,
not at all.
No.
So,
no.
Well, I want to just say thank you so much, Halie, for all of the amazing work that you are doing, and I appreciate you. And I don't know that I've shared this with many people, but before I was a nurse, I was actually a nurse's aide in a nursing home, and it was in a little bit of a difficult time of my life. And at that time, I felt like all of my closest friends were in their 80s and 90s. And, you know, people who live in a nursing home are just normal people. They just need a little bit of help in their daily lives. And, you know, those people have value and worth. And I think that they absolutely have to be treated with care and dignity. And it is so important that that they're protected from this terrible virus, and we don't lose our elders before their time. So thank you for all the safety measures you're putting in place. And thank you everybody for joining us. And if you posted a question, I'll go back and look through the comments and reply to that. And I appreciate everybody for joining us. And
thank you.
See. You have any final farewell to everybody?
No, I think we got it all. Thank you for letting me come on here. Yes, definitely wear a mask. Wear your mask. Wear it correctly too.